In 2023, there were 10.3 million measles cases and over 100,000 deaths, predominantly among children under 5, marking a 20% increase in global cases. This surge has raised alarm among health officials, prompting Saint Lucia's medical experts to intensify efforts to raise public awareness about the severity of the disease.
Measles is a highly contagious viral infection which spreads when an infected person breathes, talks, coughs, or sneezes. The virus is airborne and can remain infectious in the air for up to 2 hours after an infected person has left the area. A single infected individual can spread the virus to as many as 10 to 20 susceptible people. The time between infection and illness averages 10 to 12 days, but may extend to as many as 21 days. In the early stages, the clinical picture may resemble that of the common cold, with fever, runny nose, and cough, but later is accompanied by red and watery eyes, small white spots inside the cheeks, and the characteristic rash, which appears on the face, along the hairline, and spreads downwards towards the rest of the body.
National epidemiologist Dr. Michelle François is urging parents to take immediate action, warning that children under 5 are particularly vulnerable to severe complications from measles, including diarrhea, dehydration, lung infections, blindness, and brain inflammation, which can be fatal,
which may progress to death. There is no specific treatment for measles, and management is focused on relieving signs and symptoms and preventing complications. Immunization is considered one of the most effective measures in the prevention and control of measles. The World Health Organization estimated that between 2000 and 2023, measles vaccination prevented more than 60 million deaths worldwide.
With measles' high infectivity, community protection requires 95% immunity to prevent outbreaks.
Saint Lucia has not recorded a confirmed case of measles in decades. However, our low immunization rates mean that the island remains susceptible to a measles outbreak if a returning national or visitor is infected. The following guidance can help keep you and your family safe. Ensure that your child receives both doses of the MMR vaccine as per the recommended vaccination schedule. If you or your child are unsure of your vaccination status, contact your nearest wellness center for guidance. Before you travel, ensure that you are aware of measles outbreaks in your destination country. Remain vigilant for signs and symptoms of measles, particularly if you or your child have had contact with individuals from regions experiencing outbreaks. Follow proper hygiene practices, including regular hand washing, covering your mouth and nose when coughing or sneezing, and staying home when unwell.
Dr. François reports that as of 2023, the island's MMR vaccination coverage was 85% for the first dose and 83% for the second. The Ministry of Health reaffirmed its commitment to proactive disease prevention and regular updates on the situation.